Welcome back to the Winder Wellness Virtual Summit. We are here with Dr. Denise Baker, who is actually an allopathic practitioner that does functional medicine. So I had the pleasure of meeting Dr. Denise Baker a few years ago at an event and then spent some time with her at the VIP dinner in Tampa. And I was just so excited because I thought she'd just be such a great addition to the Winder Wellness Virtual Summit speaking tour. And so here she is. And she's going to be talking to us today about bone health, staying strong through the years. So Dr. Baker, welcome. I'm so glad you're here.
I'm happy to be here, and I'm excited to be able to speak with all of your listeners and your viewers and see if we can address some of their questions and some issues that have come up for them, for their health, and talk about encouraging them to maintain great health for themselves and seek care if there is a problem with their health maintenance.
Oh, absolutely. I mean, it's so great to have somebody with your credentials here, chatting to our audience about some, prophylactic things that they can do to help them with their health, and not just, hey, here's a pill for an ill. And I know that's not how your practice is run. So can you give us a little background about yourself and your clinic and what you do and where you're located?
I have been trained classically in allopathic medicine, and I actually went into medicine fairly late in life, in my mid-30s, after having had 3 other primary careers. And eventually I decided what I wanted to be when I grew up. I went to medical school at University of Florida in Gainesville, and then did my residency in obstetrics and gynecology at University of Kentucky, and then was delighted to come back to Florida. But one of the things that I really liked about the field of obstetrics and gynecology is that we had an opportunity to help women with their health care, not just ill care, but also preventative and maximization of good, strong health. And I found that during a woman's pregnancy time, she had an unusual or an uncanny sense of listening and ability to evoke changes for themselves. So it was a time in their life when they could listen to what was saying, say, what can I change? How can I give this, my future baby, the best start at life? And they then were able to capture the concept of good health, good medication in the form of good food and healthy exercise. And if you look at historically what goes on when they talk about good medicine, even from before the year 0, before the year 100, before the time of Christ, when there was the big change in how we approach things. Look at the old philosophers who talk about your food is your medicine. And it was the concept that you can do a great job taking good care of your health, preventing problems later on by eating well. And that's become a huge challenge in the 20th century and the 21st century is the food support. But it was that training and the concept of nutrition and dietetic intake that made a difference for my patients and really gave me the opportunity to help patients evoke changes for themselves. And so then I came to Florida about 34 years ago and set up private practice, and I have been in a moderate group and solo group practice, and am now simply working in a great basic health program. It is in a form of an interventional program in an unusual way. We basically do good work. I am working with Dr. Cynthia Clark, who is an Eastern trained medicine, and I, as a Western trained medicine, have found that the 2 areas are really come together very tightly. We each believe strongly in nutrition and support for the body. And what's interesting is the biggest difference that I've noticed is that with Eastern medicine, they start with tiny doses and multiple nutritional support that is either purchased or that is derived from her own pharmacy of Chinese herbs and plants. So it's using small doses to evoke good health. And then we only resort to medications and pharmaceuticals when that has been unsuccessful or there's been a problem that has developed either acutely or chronically that has not been discovered. So I'm working currently at Longevity Wellness clinic in Bradenton, Florida. You can find me at drbbaker@longevitywc.com. But I'm hoping that some of you will submit questions for us today so I can answer some of those questions online. So I've gone through the traditional medical paradigm with office-based practice and surgical-based practice. I've had a medical spa and have done a lot of work with laser lights through the years, but also with body contouring and a lot of options for patients to take care of what they perceive as things they wish to work on. So I am honored to work with Tracy. I'm honored to work with Dr. Weiner's group and Nutritional Frontiers as one of the sources of two things. Number one is patient education, and the other thing is good products that we can bring to you. When I talk to you about products, it's one of the things I want you to pay attention to. You don't have to remember it, but I want you to hear it. There's a concept in our world about GMP, good manufacturing processes. What that means to you, though, is that if you buy a product, you need to know that what is in it is actually in it. What isn't in it isn't in it. So you need to know the potency and the purity of a product. And that's one of the wonderful things that Nutritional Frontiers does for us, is it gives us a well-stabilized product that has been tested and evaluated in a manufacturing plant that is a GMP plant.
Well, that's a great summation, because Jamie always talks about that. He's always speaking to the point that you have the same testing company, right, that comes over, but it's the sourcing of ingredients and manufacturing that really matters, because McDonald's and Capital Grille all serve food, but it's the quality of material and purity. So thank you for that recognition, because we work hard at that at Nutritional Frontiers. But I loved what you said, that during pregnancy, we evoke more changes for ourselves because we know the impact affects somebody else. And isn't that just a general statement in health? Doesn't our own personal walk in health affect other people who have to take care of us, maybe costs on insurance, long-term care? And, you chose this topic of bone health. It's, doctor, it's not sexy anymore, right? It's not what the hot topic is on the market. We're talking about bigger, badder things now. But it absolutely is poignant, because we have more orthopedic injuries than any other country in the world. We have a very large obesity issue. We are the fattest country in the world. We consume 70% of the medications produced in the world, although we make up 5% of the population. So why did you pick bone health? Why did you choose this topic? Because this has a lot to do with women. I know I see people in my practice that they don't even think about their bone density as a problem, right? They don't think about it, but they're on all of these prescription medications for bone density. And I'm like, well, you didn't mention that you had osteoporosis. You didn't mention you had osteopenia. And they're like, oh, it's like an accepted norm of women's aging. So I love this topic. I'm interested to hear your thoughts on that.
We typically think that as we're growing up, we are building bones. And there's a very strong basic tenet that I want your listeners and viewers to be aware of. Bones are very, very dynamic. Bones are very dynamic. And by that, I mean, you can break down bone every night and you can build up bone every night. And when we're young and when we're basically healthy, child growing up, teenage years, early 20s, we know that the bone strength and the bone mass, the density of the bone, actually are developing and reaching a peak. So by your mid-20s is when we start seeing a plateau. And then by our 30s, as we get the subtle changes with hormones, the hormone levels go down, the bone densities go down. And for those women who have premature menopause, that they're losing their hormones, their bone density goes down faster. So what does that mean? It means that the cells that break down bone are working more than the cells that are building them up. So it's a dramatic change in the density or volume of bone that occurs. and we start seeing a change in the 30s. We start seeing it more in the 40s when women can begin to notice the changes in hormones. And then by the average age of menopause, and in the United States, that's 51.8 years, rounded off to 52 years, you have lost a significant amount of the bone you developed up to the point you were in your mid-20s. But how do we diagnose low bone mass? Low bone mass is not something that shows up. Low bone density and the brittle bone disease called osteoporosis isn't evaluated with any blood test that you do, or any activity test that you do, or any confrontation test that your doctor may do. It is only really discoverable with a bone density test called DEXA. So I want to share something else with your viewers and listeners, that traditional insurance was set up for ill person care. So if someone says to me, I'm only going to do what my insurance covers me, I know we're behind the ball, because we have to educate that person. There's a lot that they can do to take care of themselves before they develop a disease that needs a test, a procedure, a surgery, or a medication. So I'm encouraging your viewers and your listeners to really say, what am I doing for myself? How do I keep myself healthy? What are the things I need to be working on before brittle bone disease takes over my life for the second half of my life? So our bones build up, build up, build up, build up, and then slowly come down, come down, come down. That's important to know, that if you don't have a DEXA bone density study, you're not going to know where you are on that continuum. And it's important because if you're starting to lose bone mass, you won't know it until it's a problem. But there are some risk factors. So we know there are some significant things that I want you to pay attention to and think, does this pertain to me, to my family, anybody that I love, that I care about, my best friend? What's going on with your bestie? So the biggest risk factor for losing healthy bones, let me ask you something. If you don't have healthy bones, how are you going to contain your organs and your skin? You have to have a good, healthy bone frame to be able to have some place to hang your skin and your organs. It gives you the ability to move. It gives you the ability to interact with your environment. So I want you to always think healthy brain, healthy body, strong bones. It's important. But what are your risk factors? Number one is your chronologic age. Men, unless they have andropause, are not going to have the same risk factors that the women will have, because men have a lot more testosterone, which by itself can help support the bone health. So age is the biggest factor, and insurances may only cover bone densities by 50 or 55 or 60. But I do recommend that within a couple of years of the time your hormone levels have started to change, you have your DEXA, dual energy absorptiometry testing done, or DEXA, DEXA, bone density done. And you want to have it done on your back and your thigh bone, not on your arm, not on your ankle. You can do those as screening tests, but there's not a good correlate. And if you look around your community, you can actually call and say, if my insurance doesn't cover it, what would it cost? So age is number one. A second factor that's really big is family history. Is there a family history? Number one, loss of height. I can remember watching my grandmother, who started at 5'6", who before she died was 5'1". That's a red flag for me and all of my genetic relatives. So osteoporosis, which is the brittle bone disease, or osteopenia, which is the precursor, it's the low bone density that puts you at risk for osteoporosis. So family history. What about low calcium? Well, are you one of those people who is raised on sodas? If you are, then you probably didn't meet that initial high level of calcium that most people have around their mid-20s. Or do you have a health condition that makes it hard for you to absorb it because you have a problem with your stomach, stomach acid, or small bowel and large bowel? How much caffeine do you take in? Because caffeine will interfere with your body's ability to be able to absorb the calcium and can interfere with your body's use of the calcium and compete. People who are taking caramel-colored beverages, sodas, pops, but even chocolate, coffees, certain teas will make a difference. If you have premature menopause before that average age of 52, you know that you've lost your hormonal support. So women who go through menopause will lose about 50% of their, or will have about a 50% reduction in their ability to use calcium and can drop to 50% of their bone density within 5 years. Typically, if you're healthy, you're moving, you're paying attention, you're getting your vegetables and your fruits and your proteins in each day, it won't be nearly that fast. And you might lose 5% a year for the first 5 years. So that's a big deal. If you're only losing 5% a year for the first 5 years, you're at 25% of what your bone mass was at its ideal when you were 25. So if you go through menopause at the average age of 52, and you're going to live to 95 or 100, you've got to do things that will really, really support your bones. What are some of the other risk factors? Women who are small in stature, women who are Caucasian or Asian. My Asian patients actually have a high risk of osteoporosis and osteopenia as well. Those people who are using tobacco products, not just smoking, but also vaping, that actually will create another condition in the bones and will interfere with your ability to use your nutrients and will decrease your ability to absorb. If you have heavy alcohol use, well, what do I mean by heavy alcohol use? Relative to your healthy bones and keeping your bones healthy throughout the years, what that means is more than 4 glasses of wine a week or more than 2 mixed drinks per week. Now you're going to say, that's not really heavy alcohol. Try to limit your alcohol so that it doesn't interfere with your good, healthy bone framework. If you have heartburn, if you have GERD, gastroesophageal reflux disease, those are conditions that, and you can't tell with those conditions, do you have it because your acid is too high or too low? But those are conditions that interfere with bone metabolism, but also medications over the counter or prescription can interfere with your body's ability to use the nutrients and absorb it from your diet. So if you're doing the best job you can, but you're treating over the counter medications to treat your heartburn or your GERD, you are interfering with your bone metabolism. You're hurting your own bones. You're making it so that this bone structure that you have might not make it without fractures, without bones, without spurs, without fractures until you're older. If you have had a lactose intolerance or lactose dislike, you may not have as strong a bone buildup to your mid-20s. Those of you who are small, or if you have endocrine abnormalities, thyroid that's too high, thyroid that's too low, problems with your parathyroid gland, those 4 glands that sit on top of your thyroid gland, abnormal kidneys. Can your body utilize and make and convert vitamin D, which is also important? So those are the risk factors that we talk about. In the other category, other than the general risk factors for it, we also talk about a sedentary lifestyle. Use every moment you can to move a little bit more. Every bit of gravity-based movement will help put true healthy strain on your bones. That's a good thing for you to consider doing. Well, what else? There are some other medical illnesses that are problems for it. We talked about hormonal problems. We talked about thyroid, parathyroid, adrenal gland problems. Patients with adrenals that are overactive or underactive also can affect your bone health throughout your years. If you've had ulcer problems, stomach problems, gut problems, certain kinds of cancers, and certain kinds of medications. So all of those issues interfere with your body's ability to make healthy bones, keep them strong, and increase your risk for fractures later on. Now, osteopenia, which is the condition of low bone mass that puts you at risk for developing osteoporosis, is a silent disease. Osteoporosis, brittle bone disease, is also a silent disease until you fracture. So you probably have heard over the years that, oh, my aunt fell and fractured her hip. The studies are really very clear that it is more likely and very reliable that the person who did that actually broke their hip and then fell, not the other way around. And the statistics are very, very grim if you get to that point, which is why I want you to keep your bones healthy and strong throughout your whole life. The statistics are sad if you break a hip. 1 in 5 will be dead in a year. Another 1 in 5 will be in an assisted living facility for the rest of their life. Another 1 in 5 will have mobility problems and need mobility assistance the rest of their life. 1 in 5 will have a temporary mobility issue, but will be able to recover. And only 1 in 5, or 20% of men and women who break a hip, go back to a prior life unimpeded by mobility. So that's the end game. That's not what I want in your future. I want you to recognize that there are things you can be doing to take care of yourself outside of what your doctor tells you, to make sure you have good, healthy bones and you keep them healthy. And once they are not healthy, you are doing all the things you need to do to be your best friend, to take good care of you, restore the health of your bones so that you can be active and mobile as a 95 or 98-year-old person. That's one of our goals for you. So there are a number of things that you can do, but now that you know your risk factors, you can look inward and say, what are my risk factors? What are the risk factors for my family? What is it I need to be taking care of for them? So that's the next question. Do we have any questions so far? Okay, I want you to start thinking about bone health in your mid-20s.
Sorry, I could get my mute off. There is one question.
Sure.
What age should women start thinking about bone health? And then I have a question about something you said.
All right. So you start thinking about bone health when your baby is born. So you're going to think about it for somebody else, for your child. When you are the person who is the model for that person for good, healthy eating, getting their 3 to 5 vegetables a day and making sure they're getting their calcium-rich products in, make sure they're getting their veggies in. So you will, number one, be their model. Number two, you will be the person who will be in charge of, or guide the person who is in charge of, their eating patterns. Because good health starts from within, and good health starts with, what am I doing for myself on a day-to-day basis? If you're great with that, you don't have to be a messenger of problems and issues and reports to your doctor, because you're doing the best job for yourself. So then you continue to build bone. You make sure that you're modeling, not drinking a lot of coffee, not a lot of alcohol, you're not smoking cigarettes, you're walking and moving all the time, you're not taking in sodas or pops or caramel colored beverages. And that by the mid-20s, you should have hit, approximately 20, hit your peak bone mass. The next phase of someone's life is, if you talk to most 25-year-olds, they're not going to be thinking about or highly engaged in 5 vegetables a day, adequate protein, 8-ounce glasses of water a day. Be careful about it. But that's probably the biggest thing that's missing in our community. I don't notice it as much with my European patients, but the American patients, it seems to, that whole nutritional factor seems to be taken out. So it's what you train at home for first, because what people do at home, they tend to take to their own home when they move out or grow up.
Isn't that funny, that verse, right? Train them up.
Yes.
So train them up so they don't depart from it.
That's exactly right. But you're the model. So if you want your next generation to be healthy and great and happy, you are the model for them. And you are the one who is then encouraging them on good health practices. So maybe they don't need to come and see me in the doctor's office because they're ill. There's a lot you can do to help with that. So you start thinking about bone health by 20s. Hormones do start to decrease in the mid-30s. And so when I am meeting with a patient and they're in their mid-30s, if they've finished childbearing, then we start going into the next phase of what I want them to be doing for self-care, for taking care of themselves before I need to use big guns such as surgeries, drugs, procedures, and tests.
Yeah.
But certainly, hormones are going down by their mid-40s, and if I had my preference, I'd have my hands on that patient by her mid-30s, but usually I don't get them till their mid-40s.
Yeah, until they're sick. You get them when they're sick, not when they're thinking about trying not to get sick.
But that's why what you're doing here, Tracy, what Nutritional Frontiers is doing, what the allopathic physicians seem to have forgotten, many of them have, what a lot of the naturopaths know, what a lot of the people who are very involved with nutraceutical supplements know, they're the ones they need to be listening to.
Mm-hmm.
What are the areas
Say it again.
of functional medicine that we can use to take care of ourselves now so I don't have to have procedures, surgeries, drugs, medications? If everything else fails, then you have to go to that, fine. But there are many ways to not have to end up on that conveyor belt of procedures, surgeries, interventions, and drugs.
Yeah, absolutely. I love it. So you talked a little bit about premenopause being one of the risk factors for losing bone density. And you said it's because of the inability to modulate calcium. What cascade of hormones affects that?
It's interesting because within about 5 years of menopause, whether it's the average age of menopause or premature menopause, I like my patients on a good nutraceutical support. There's not a great way to test in the laboratory what a patient's calcium level is or what a patient's vitamin absorbability is, but we do have some serum levels that I like to follow. I do have options for the patients to do a nutraceutical evaluation where we actually measure their levels of vitamins in their body. And it's frequently not covered by insurance. So people think, oh, well, if it's not covered by insurance, then I probably don't need it. But the opposite is true. If it's not covered by your insurance, it means that it's usually not used for people who have significant disease states. Mm-hmm. We want to keep you healthy. So I will measure some of the vitamins in the patient's body. Traditionally, when you talk about bone health, we talk about calcium. And I actually do a series of bone labs where I'll look at the ionized and the non-ionized or ionized and serum levels of calcium. I also want to see how the parathyroid is working because that interacts. Mm-hmm. I want to know what their vitamin D level is. Very, very important. And we'll come back to the vitamin D in a minute.
Okay. Can I ask you a question on your parathyroid comment? Sure. So there's a very common surgery where that's removed. I mean, is it really just no hope, or is there a way that you can save that? Because the parathyroid seems to become calcified, right? So
there are several ways, and I don't know if any of your viewers or listeners are familiar with energy work, but one of the practitioners that I work with does a lot of energy work to actually help restore function. Outside of that, I have discovered in the past 10 years 4 patients who have had a parathyroid malignancy or a cancer. And it was found because something in their history or their bone density or their family history said, I need a bone density. And frequently, if there's anything that's abnormal, sometimes even before I get the bone density result back, I will run what I call bone labs. And I look at the parathyroid level. And if it's abnormal, I don't do that kind of surgery. I do some surgeries, but I don't operate on that. So we'll get radiologic evaluation of the thyroid glands. And I'm getting to your question, Tracy, to evaluate it. But we have 4 parathyroid glands, 2 and 2. They sit on top of the thyroid, which hence para. But if there's a problem with the parathyroid gland being too high and creating abnormal bone mass, they don't have to take out all 4. They may be able to only take out 1. So I want your viewers and your listeners to be aware of only remove that one which is abnormal, because you still need to have good metabolism and function of the minerals that you ingest and the minerals that you use. Simply because the parathyroid gland is calcified does not equate with abnormal function necessarily, or absence of function. And presence of calcium in the thyroid gland does not necessarily mean cancer or malignancy. So
see, that's the thing right there, because that's not the information these people are given. I have recently had a few people call me and said, I had my parathyroid removed. I'm like, well, all of them, which they don't know. They don't know. They don't know.
So here's a hint,
right?
for your listeners and your viewers. Get a copy of your pathology report.
Yeah.
And then anyway.
That's what they say.
Yes.
Yeah, like that. My doctor said it's cancerous because it was calcified. So I'm just like,
which one?
Exactly. But they don't know there's four. They don't. That's what I'm saying. Like, I think some of the health issues that we as a generation of people, right, we don't know what to ask, because we're told just to quiet, don't question the doctor. That's been the first process. Now with Dr. Google and Dr. whatever, Amazon, we walk in with a million questions and our doctors feel defensive and challenged rather than the right questions. So I appreciate this, to give our audience the right questions to ask about your health, and, to be informed when you walk in there, right? Ask for your pathology before you make a decision to have everything removed. Which one is affected? And can we just do that one, doc? Now, of course, some doctors will say, well, the other ones, they're going to get diseased eventually, so we might as well take them all out now. So what is the long-term impact of that removal?
I have only had one patient ever in about 35 years of practicing medicine who have had all four taken out. But I also talk with my patients, and I talk with my clients, and I talk with the doctors, that if there's a problem in one thing, we can talk about removing that one, but leave everything else, because you change the body's entire ability to process minerals in the way we were born to process. So it can create mineral deficiencies or abnormalities that will impact you the rest of your life. If I have someone who comes in and is relatively healthy and says, my grandmother or my mother has osteoporosis or was shrunken in height, I'll give them the generalities. They'll need vitamin K. They'll need a good multiple vitamin, such as the multiple vitamin that they'll take. They also need a multiple minerals, and the frontier minerals are great for that. But I like them on calcium, boron, zinc. And there are recommendations, guidelines on how much of those to take. But we have them do that all in the process of good health, good exercise, calcium-rich products, and then good nutraceutical support. So one of the things that I work with my patients about, and this is a little off task, but is I used to teach a course on how to talk to your doctor and how to keep track of your medical records. So I encourage everybody, and you will get some pushback from some people. I want you to get a copy of your records when you for every visit, and I have them arrange their notebook. And Tracy, certainly, if you want me to do a lesson on that for your audience, I
just wrote it down.
Okay.
How to talk to your doctor. Yeah. I love it.
Okay, but I want the patients to be on calcium and vitamin D. There's a medical food that is available, usually not covered by insurance, but actually does have some substances that actually help bone metabolism. And then there are functional approaches to osteopenia, osteoporosis, or the risk therefore. And this past week, I sent another patient to physical therapy because I want the physical therapist to teach that person what to do to maintain a good skeleton structure, maintain good posture. We're working on the nutritional intake. We're working on the functional intake, and we're working with the nutraceuticals for them. But also, I want them to take home from that process, from those lessons, what they're going to do 3 times a week until they're 100 years old. And if they want to stop at age 100, I'm all for it. We'll talk about it then. But
well, I did personal training out of the gate. That's what my first degree is in, right? Is exercise science. I used to say to people, like, you got to give your bones a reason to use it. This little osteoclast and osteoblast, they build and break down on stress of the skeletal system. And women were like, well, I don't want to weight train because I don't want to get big. I'm like, you genetically can't get big like that. You're not going to be Arnold Schwarzenegger, like, but you are going to have healthy bone density. And that's what creates that, along with having the nutrition to rebuild it. That's the big thing. You know, in the fitness industry, they worry about protein, protein, protein. But they're not worried about assimilation of protein, and they're not worried about bone density and the need for calcium and vitamin D and magnesium and all the things that facilitate it, and healthy hormones to keep the bone density. And normally what happens is they get injured because they are putting too much stress on a system that doesn't have the nutrient density to rebuild fast enough. So I love this whole talk because it's not just about, you know, getting older. It's about being right where you are right now as women. And just because we haven't talked about this subject doesn't make it valuable. And just because something else in the world is now in the forefront, right? This big bad virus. Yeah. Ladies, your bone density is still depleting. You need to pay attention. It's still there.
It's not just our menopausal or perimenopausal patients. I had a patient who was 19 years old, went to school in northern central United States in Minnesota, and came home for spring break and was having some problems. Well, in talking to her and taking her history, she hadn't had a period the whole year. And when I evaluated on exam, I thought she had ligamentous strain and possibly a fracture. I looked at her with my ultrasound. I knew she had a tendon that was partially disrupted. And when I got the x-ray, she had a fracture. And this is someone whose hormones were abnormal because she was exercising at that level. Her hormones were abnormal. She was not having periods. And she ended up with a amenorrhea or absence of period, stress fracture, and ligamentous injury because her hormones were not working appropriately. And we could help her boost her back to the point that she was having a good level of exercise, able to participate in an NCAA sport after she recovered. And she went back and actually qualified for the Olympic team. But it was a matter of keeping her hormones healthy and giving her the awareness, giving her the tools of what she was doing the whole time she was up at school so that she could take care of herself. So it is throughout our years. It isn't just when you turn 52 or 53 or 60, whenever your periods stop. It's even for our young ladies, the late teens, the early 20s. It can affect you at any point. So the most important thing for you to do is to keep a running list of what symptoms you have. And if something changes, your job is to report to your doctor what you notice, what's different, what's the same, what's bothering you. And I have some patients who will come and see me 2 or 3 days in a row because we have to handle everything, and I'm restricted by what their insurance can do. The nice part about seeing patients outside of that, they are able to choose how many minutes they're going to meet with me. Are they going to meet with me for 15 or 30 or 45 minutes or an hour? And we can get a really good basic sense of what they're doing. We can test, we can do energy testing, muscle testing, we can do serum testing, we can do urine testing, lots of different tests that are appropriate for that person's history and their family history, but also what their complaints or what they are noticing, what they've reported to me at the visit. So it is throughout our entire age. But if you end up having low bone mass, that's the wake-up call. That says, okay, I haven't been as good about taking care of myself now. I'm going to step further and I'm going to start taking care of myself. My goal is that when I look at a bone density, if they have low bone mass, I can get them healthier and not let them continue down that road so that they are always going to have low bone mass and eventually osteoporosis. Yeah. It's a matter of teaching. And if you look back to the early philosopher time, they talk about physicians as teachers. Well, with the current paradigm in medicine, you get your 6 minutes or your 7 minutes or 8 minutes. And I have a hard time teaching somebody what they've missed in their education in a 6 or 7 minute visit. So do a lot of self-education. Take your questions. When you go to the doctor's office, hand your list of questions to the nurse. Use the nurse as your advocate. And they may say, we can handle 1 and 2 and everything else we'll handle another visit. It's okay. It's already on the list of what you're covering for them. Okay? But it takes a lot of work on your part too. Sorry.
No, it does. Absolutely. I always say 90% of your results are up to you. I'm 10% of the equation. I can point you down the path, I can make the recommendations, but you have to walk it. So, with that said, I loved your quote about insurance is significant when you have significant disease, right? So,
Mhm.
this is usually out of pocket. Preventative health, unfortunately, because it's not recognized by the insurance companies as being necessary. But really, insurance companies are in the game of disease management, not
They are.
healthcare.
That's
We are
exactly.
the healthcare, right? So
Say that
um,
again for your audience. Say
I
that
said
again.
insurance companies are not in the game of, they're in the game of disease management, not healthcare. So that's where they make their money. They're going to make it on the prescriptions and the surgeries and the chronic illness, because that's how they get paid. They don't get paid by healthy people. They don't get paid. That's your insurance policy every month, right? You pay for something you don't use when you could be taking that money and putting it towards your preventative health, investing in your future. Now, catastrophically, things can happen, right? I mean, you can be in an accident, have a trauma, but that's what insurance is for at that point. That's where it can kick in. And I'd rather have a higher deductible and pay less per month and put that other money towards good health
It's a
than
good
have a policy that covers everything. Robert Scott Bell, who's coming on, he said at the April PTE, he said that the most dangerous thing walking into the hospital is a really good health insurance policy. And boy, is he right, you know? So I wanted
I
to
encourage the patients to and our clients to look at health insurance the way they look at automobile insurance.
Hmm,
Automobile insurance is not used for maintenance.
that's
It's
right.
only used if something bad happens. And that's what I hope for the patients, to use their insurance only if something bad happens. Let it be the safety net for them, because what they're doing for themselves, to themselves, and within themselves is what's going to equate with good health, if they chose good parents.
Love it. Love it. Absolutely. All right. So let's get to the solution. What is your protocol and plan when somebody comes to you and has the issue of, poor bone health or density? What does that look like? What nutrients do you recommend? What exercise? What foods? Give me the whole thing. Just
So
lay it out, Dr.
we
Baker.
actually, that's okay. We actually give them a food list that I like the patients to use. But in general, you're going to work on behavior. Number 2, you're going to do your exercise. Number 3, you're going to work on your calcium-rich foods. Number 4, you're going to do your nutraceuticals. Number 5, you would add your medical foods. And then lastly, number 5 is your physical therapy. And lastly are your medications or your drugs. So I want you to pay attention to your behavior. Behavior is number 1. And so it's reduction of tobacco and halting of tobacco products. Limit alcohol. Alcohol in itself isn't bad, but I don't want you to have too much. I want you to limit it to a couple of drinks a week. You want to limit or reduce your caffeine consumption. Sodas, coffees, teas, chocolate. All of those will have caffeine in them. And the other thing is
Those are fighting words, Dr. Baker.
Well, as someone who went through a residency program, I understand the issue of the caffeine. I really do.
I was more concerned on the chocolate, but okay, we can still work with this. Okay, go ahead.
It's fine.
That's
But
fine.
I don't find,
For the whole bar? No?
I have
Okay.
a couple of patients that will take a small square and they get that every single day. They're doing a good, prudent job.
That's just my magnesium deficiency speaking. That's all. I can take magnesium. Okay, continue.
Okay. And diet rich in calcium, calcium-rich foods, and be careful about your antacids. Many people who develop heartburn, GERD, reflux will take antacids, but what most people don't know is that the amount of hydrochloric acid, the stomach acid the body produces, gets lower and lower and lower and lower as we get older. So the symptoms of low acid production and the symptoms of high acid production are the same. You cannot tell based on what the patient is feeling. So even though a lot of people will have heartburn and will try to take an antacid or this or that because they think the acid in their stomach is too high, it may be that it's too low. So that's something that's rarely discussed. But if you're taking antacids, get that under control first. Use the antacid if you have to short term, but please, please get that under control so you won't need to take those at all. So the next is your exercise. And I really want you to be doing your aerobic exercise, your weight-bearing exercise with caution. Remember, if you have any medical conditions, get your physician to clear you on what kind of exercise you can do. But what's important is you need a minimum of 30 minutes 4 times a week. But that's not the minimum amount of exercise someone who is over the age of 52 needs. So I'm going to talk to you about a prescription for exercise for the younger half of your life, which is 30 minutes nonstop 4 times a week. Once you're over that 50 hump, you then have to gradually over time work to 420 minutes of aerobics a week. That is a number that I rarely give patients out of the gate because it can be de-incentivizing. Some patients, a few will say, give me what my target is and I'll work to that. But it may take a patient 5 years to get to that, or 6. But if you're going to live to age 100, what difference does it make if it takes you 5 or 6 years to get to the 420 minutes of aerobics a week? It doesn't. Just gradually get there and use every moment you can to do your to move. But you also need weight-bearing exercises, and that's why I'll send a patient to physical therapy, because our physical therapists and our exercise physiologists are wonderful about looking at what the patient can do, look at what their strengths are, what their weaknesses are, and give them great guidance for managing that. But you do need your weight-bearing exercise because bones are very dynamic. You can build them up, you can break them down. And if you are doing good weight-bearing exercises, you can actually use the dynamic force of the osteoblasts and the osteoclasts to build your bone. Bones are not static. Bones are very dynamic. So you want to make sure that you have good weight-bearing exercises. And one of the other things I want you to do is to work on balance. Balance is important because balance and a good balance retrieval mechanism in your brain and your body and your muscles, and using the muscle memory for that will decrease the risk of a fall or allow you to change from what could be a fall to a non-fall event. So you get clearance from your doctor. You're going to have 2 forms of exercise. So number 1, you're going to be cautious with your behavior. Number 2, you're going to use good exercise, both aerobic and weight-bearing and balance. Number 3, I'm going to encourage you to use good common sense when you're using and taking your calcium-rich foods. And I'll give you a list of them. It can be sardines. Sardines have great calcium in them. Almonds and turnips, broccoli and salmon. The mustard greens, cauliflower, okra and kidney beans. Those have great amounts of calcium in them, as do orange juices. If any of you eat Swiss chard, that works nicely, figs and raisins and cabbage. But if you're not able to meet your body's needs with the calcium you're getting in your calcium-rich foods, then you're going to use your nutraceuticals. And so there's a group of nutraceuticals that I talk to patients about. And I like them to be on a good multiple vitamin. But by your mid-30s, you need to be on a good mineral-based support. What Nutritional Frontiers has is a nice, well-balanced, multiple mineral product called Frontier Minerals. And it gives you a lot of the small products. It has some vitamin D, and it has the calcium, it has iodine, it has magnesium, it has zinc, selenium, it has boron in it, and that's something that's often forgotten. It also has some manganese, some chromium, but you want to make sure you're getting enough calcium, vitamin D, zinc, magnesium, boron, because those are the bases. So you can also use a Super K2 Plus, which is stronger, or if you're at a good point where you don't have to replenish and replace, you're just doing maintenance, you can use the Super Cal Plus. There's a product that helps the stomach. So if you're one of those who is having problems with indigestion, heartburn, reflux, GERD, I want you to look at the Betazyme products that Nutritional Frontiers produces, because it can actually boost the health of your stomach, help to balance some of the acid abnormalities, and help you to actually absorb more of what you're taking in your good diet. I want to deviate a little bit And I don't have a farm. And although I have a big backyard, I work a lot. So I don't make or grow most of my own vegetables. Remember that if you're really good about buying just fresh fruits and vegetables, how does it get to you? Pay attention to whether they're organic. And if you can, maybe support your local farmers market. But I want you to think about this. Much of the fresh fruits and vegetables and produce that you would use is sent where? From the growers to a warehouse. And it sits in the warehouse. And it sits in the warehouse until they get the orders. And then it gets gas ripened and then sent to the store. So if you don't know the source of your fresh fruits and vegetables, you may have lost up to 50% of the nutrient value when that fresh substance was gas ripened to be sent to your store. That's a little aside we can talk about later, but pay attention to the source of your fresh fruits and vegetables, please. And I'd like to take a break and kind of talk about vitamin D. When I'm looking at someone's bones, and I'm concerned because of family history, personal history, conditions they've had, procedures they've had, hormone status, I'll do a panel of what I call bone labs. And I'll look at the serum calcium and the ionized calcium parathyroid. I'll look at thyroid function as well, but I'll also look at the vitamin D level. And I look at the metabolites of bone breakdown. And up to this point, almost all of them have been covered by insurance, but as insurance are cutting out more things that they cover, they may or may not be covered or paid for is really what they should be saying. But I want to talk about vitamin D. Vitamin D is important. And yes, you can make your own. You can do a peripheral conversion to the active form of vitamin D in your skin if you're outside. In Florida, we get so much external ionizing radiation that I'm concerned about the risk for precancers and cancers of the skin based on the amount of ionizing radiation exposure throughout someone's lifetime. So this is another great case of some is good, more is not necessarily better. But if your vitamin D level isn't high enough, you can supplement, and the supplementation is very easy and straightforward. And your dose is based on what your serum level is. So in the United States, they consider a level of 30 micrograms per deciliter or above normal. And I'm going to tell you that good healthy state and good healthy bone state throughout your life needs a level of about 80. Now, most of the allopathic and the chiropractic docs would back off from that. But those who understand functional medicine and those who know that taking care of ourselves little by little by little will lead us to a healthier, older life, recognize that goal level of 80 is what you want to go to. So I usually shoot for a level of between 80 and 100 with my patients and my clients. A level higher than 100 really has not been associated with a major disease state. And we know that there are additional issues with levels that are lower. Most of your traditional physicians will say a vitamin level of 30 is okay. And I'm going to tell you it's not. Because that was based on a level where the average age at time of death was 71. But I'm telling you, if you're taking great care of yourself and you happen to pick good parents, there's no reason why you're not shooting for 100. And you have to have a good, healthy, bony structure. You have to have strong, healthy bones to make it to that point. I had a patient that came in the office recently with her daughter. And her note to me was, tell mom she has to stop gardening. Well, I've taken care of mom for about 30 years. Mom is now 96. She mows her own yard. She trims all of her trees and her bushes. And I suggested to the daughter that she be there to help her during the trimming, but let her mom get out and do the things she really enjoys, because that's part of why her brain is healthy, her bones healthy, and her body is healthy. So in her 90s, she is still doing that because she is a healthy, older gal.
Wow, that's awesome. My grandmother lived to 97. And up until that point, she was perfectly healthy. And her health only started to decline when they started to do the Meals on Wheels program for her. And
she
she started to get on gastrointestinal medications. Yeah. So I think, and it was probably within 2 years that her health drastically declined. So, but that's what we do, right? We use these medications as some sort of preventative rather than adjusting the lifestyle. So this has been absolutely amazing. We would love to have you back for our next Weiner Wellness presentation, if you don't mind, where we can go over, how to talk to your doctor. I think that would be a great topic, and I think so necessary in a time such as this. Things are rapidly changing.
Well, Tracy, thank you so much for having me on. I'm honored to work with your audience and give them little hints and glimmers of what they can do to take care of themselves, and an attitude adjustment. Take good care of yourself first, and then that will radiate out from you.
Absolutely.
Have a good rest of the day. Take care, and thank you for having me on for Weiner Wellness.
Absolutely. Thank you, everybody, for joining us, and Dr. Baker, especially for all your wisdom. We have put her connection and link in the chat, so if you want to reach out to her, please do. She does in-person and virtual consults, and she is available for you. All right, Dr. Baker, we'll see you next time. Thank you, everybody, for joining us here. Stay tuned, because Jacqueline Shedden is coming up next, Testosterone for Women. She's a nurse practitioner and fabulous functional practitioner. So stay tuned, guys, because we will be right back at 11 a.m. Eastern Standard.